Hey Corey, how are you?
Hey Joel, I'm good. How are you?
I'm good. Happy Friday.
Yes, happy Friday. I'm so glad it's Friday. It's so crazy because it seems like Friday's here, and then before you know it, it's right back time to go to the office again. So the 2 days it goes by so quick.
Everyone, make sure you're making the most of those 48 hours because,
Right.
I mean, depending on what your work schedule is like, but whatever free time you have, make sure you're taking that time to do things you want to do for you and reset yourself and, get ready for another week of grinding and whatnot.
I think here's Whitman-Walker. You have to join. Oh, here we go. Here we go. Okay, I'll just go ahead and just start because I have the introduction with into. Okay, here we go. Okay, my name is Corey, and I use he, him, and his pronouns. Jewel and I we work together to bring education on Instagram live to the space of Walker's community health team. During the COVID-19 pandemic, Whitman Walker's community health department has expanded outreach efforts to social media platforms. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support.
Awesome. My name is Jewel. I use she, her pronouns, and happy to be here with Corey on this Friday. So, as of June 22nd, 2022, the current 7-day moving average of daily new cases is 97,430, and it's a decreased 5.6% compared with the previous 7-day moving average of 103,175 cases. A total of 86,512,787 COVID-19 cases have been reported in the United States as of June 22nd, 2022.
So we're going to give you some tips about safety. Of course, number one, getting vaccinated and staying up to date on COVID-19 vaccines. COVID-19 vaccines are effective in preventing you from getting sick. COVID-19 vaccines are highly effective in preventing severe illness, hospitalization, and death. Getting vaccinated is the best way to slow the spread of SARS-CoV-2, the virus that causes COVID-19. The CDC recommends that everyone who is eligible stay up to date on their COVID-19 vaccines, including people with weakened immune systems.
Wear a mask. Everyone ages 2 years old and older should properly wear a well-fitting mask indoors in public and in areas where the COVID-19 community level transmission is high, regardless of vaccination status. Wear a mask with the best fit, protection, and comfort for you. It should cover your nose and mouth securely and be snug on your face. If you're in an area with a high COVID-19 community level of transmission and are ages 2 or older, you definitely want to wear a mask indoors. And if you are sick and need to be around others or are caring for someone who has COVID-19, you definitely want to wear a mask then as well. If you are at increased risk for severe illness or live with live with or spend time with someone at higher risk, speak to your healthcare provider about wearing a mask at medium COVID-19 community levels of transmission. People who have a condition or are taking medications that weaken their immune system may not be fully protected even if they're up to date on their COVID-19 vaccines. They should talk to their healthcare providers about the additional precautions that may be necessary for them to take. For more information, you want to visit the CDC.gov's website and check out their COVID-19 vaccines for moderately or severely immunocompromised people information.
Okay, so everyone 2 years and older, including passengers and workers, should wear a mask. That's well fitting a mask or a respirator. Indoors, public public transportation such as airplanes, trains, buses, and ferries. And transportation hubs such as airport stations and seaports, especially in the locations that are crowded and poorly ventilated, such as the airport jetway. Stay 6 feet away from others inside your home. Avoid contact with people who are sick if possible. If possible, maintain 6 feet between the person who is sick and other household members. If you're taking care of someone who is sick, make sure you're properly wear a well-fitted mask and follow the other steps to protect yourself. So indoors in public, if you are not up to date with your COVID vaccines, stay at least 6 feet away from other people, especially if they're at high risk of getting sick with COVID-19. Avoid poorly ventilated spaces and crowds. If you're indoors, bring in um, bring in fresh air by opening windows and doors if possible. If you're at an increased risk for getting sick from COVID-19, and you want to avoid crowded places and indoor spaces that don't really have fresh air from outdoors, of course, because that's where COVID-19 thrives.
You also want to test to prevent spread to others. So you can choose from many different types of COVID tests. Test for SARS-CoV-2, or the virus that causes COVID-19, will tell you if you have an infection at the time of the test. This type of test is called a viral test because it looks for viral infection. Regardless of the type of test you select, a positive test result means that you have an infection and should isolate and inform your close contacts to avoid spreading disease to others. Over-the-counter self-test or viral tests that can be used at home or anywhere and are easy to use and produce rapid results. Anyone can use self-test regardless of their vaccination status or whether they have symptoms. COVID-19 self-tests are one of the many risk reduction measures along with vaccination, masking, and physical distancing that protect you and others by reducing the chances of spreading COVID-19.
Wash your hands often. You should, of course, wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. It is especially important to wash your hands before eating or preparing food, before touching your face, after using the restroom, after leaving a public space, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper or caring for someone that's sick, or after touching animals or pets. If you use soap and water, if soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hand and rub them together until they're dry. Avoid touching your eyes, nose, and mouth with unwashed hands. Jill, I can't hear you.
Sorry, I was on mute. Cover your coughs and sneezes. If you're wearing a mask, you can cough or sneeze into your mask and put on a new mask or a clean mask as soon as possible and wash your hands. If you are not wearing a mask, always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow, and do not spit. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol.
Cleaning and disinfect. Clean high touch surface. Clean high touch surfaces regularly or as needed after you have visitors in your home. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If someone is sick or has tested positive for COVID-19, disinfect frequently touch surfaces. Use a household disinfectant products from EPA's list. Like so, it's like a whole list of things like Clorox and sanitizer wipes. Everything needs to be at least if it has alcohol, it needs to be at least 60%. If surfaces are dirty, clean them using detergent or soap or water prior to disinfecting. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Take your temperature if symptoms develop. Don't take your temperature within 30 minutes of exercising or taking medications that could lower your temperature, like aspirin, um, acetaminophen. Follow CDC's guidelines if you develop symptoms. Monitoring symptoms is especially important if you're running errands, the office, or work in settings where it may be difficult to keep a physical.
Thank you all for learning a little bit more about COVID-19 or being reminded of all that we've continued to learn together during this COVID-19 pandemic. Before we go on, we want to give you, of course, a few more reminders about COVID-19 and vaccines. So if you've already gotten vaccinated, congratulations. You've taken a really important step to preventing your loved ones, yourself, and your communities from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might keep wearing your mask if you're indoors, as the vaccine isn't 100% effective at preventing new cases of COVID-19. But it is very effective at preventing severe illness with COVID-19, hospitalization from COVID-19, and death related to COVID-19. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has a COVID-19 vaccine available. Please reach out to us at 202-207-2480 for an appointment. And if you're having trouble with making an appointment with us, or we're just out of reach or not close enough for you to travel to, and you're a DC resident, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-0333. If you're a Maryland resident, you can learn more about the Maryland vaccine distribution process and schedule a vaccine appointment at covidlink.maryland.gov or by calling 1-855-634-6829. And if you're a Virginia resident, learn more about Virginia vaccine distribution process and schedule an appointment at vaccinate.virginia.gov or by calling 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, or physical distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you. Be mindful of masks and keep your distance, and especially when you do not know whether the folks around you have also been vaccinated or not. Finally, if you are looking for an STI or HIV testing appointment, you can call us at 202 797-4439 to make an appointment with our team. We offer free HIV and STI testing in Northwest and Southeast DC. And please follow our Whitman-Walker family at Whitman-Walker on Facebook, Instagram, and Twitter, and keep up with our resources and services at whitman-walker.org. And you can also follow our family accounts at NoFilterDC and at RealTalkDC_. Wishing you all a beautiful rest of your Friday and gorgeous weekend.
Bye, everybody.